I can think of few issues more important than the one we are here to discuss tonight. Before taking office, I formed an opioid transition committee so that my administration could hit the ground running and so that Cecil County as a whole could respond more effectively to this crisis. The work of that committee furnished my office with a comprehensive report assessing all aspects of our intervention and response strategies. It was important for me to know on a deep level what we were up against, how we were doing, and most importantly, how we could improve. The key takeaway from the transition report was that Cecil County lacked a comprehensive plan to address the crisis, which is, of course, what led us to establish the first Opioid Summit, which many of you here were part of, and which was instrumental in identifying needs as well as gaps in service in our fight to reduce opioid misuse and overdose and opioid-related deaths. As a result, my administration relaunched an opioid intervention team, otherwise known as the OIT, for Cecil County, which has taken that initial feedback and created a comprehensive plan for responding to this crisis. I'm pleased to share that we're making considerable progress towards our goal of reducing overdoses and overdose-related deaths. According to the Maryland State Overdose Data Dashboard, for the 12-month reporting period beginning March 2022 and ending March 2023, Cecil ranked 5th out of the state's 24 jurisdictions for the greatest reduction in fatal overdoses. That's a 20% reduction in that 1-year period. However, it's our understanding that this reduction could actually be closer to 30% based on recent preliminary reports from the health department. In terms of total overdoses, Cecil County has also seen a sharp drop over the last 3 years. In 2020, there were 532 total overdoses recorded. In 2021, 440 overdoses. And last year in 2022, that number had fallen to 315 overdoses. While this year is only a bit more than half over, I can tell you that county government and its partners are committed to using every tool at our disposal to continue making progress in 2023 and beyond. For example, we're expanding access to emergency life-saving treatments and strengthening our partnerships with Union Hospital and the Cecil Detention Center to help at-risk individuals, in addition to our full complement of education and peer support resources. I also funded through the recently passed FY24 budget the establishment of the new county-supported specialized drug task force in the state's attorney's office, which will work to keep deadly and illegal substances off our streets by stopping the infiltration of drug dealers in our communities. Let me be clear, and I think many of you know this, government in and of itself is not equipped to fight this fight alone. And fortunately, we're not. I am so pleased to be surrounded tonight by advocates, family members, caregivers, and experts. You each bring something unique to the table, and that's important as we tackle this issue together as a team. Tonight's summit is not just an update from us, but an opportunity for you to continue to make your voice heard so that we can determine what obstacles remain and strategize around new and better approaches to prevention, intervention, and life-saving measures. I ask that you be candid and speak freely about your experiences. Big ideas lead to bold plans. While our time here today will not solve this crisis, it can and will serve to move us closer to our goal of saving lives and improving the quality of life in Cecil County for future generations. Thank you again for being here, and please never hesitate to reach out to me or a member of my staff if we can be of service to you or your organization. It is now my pleasure to introduce Emily Keller, who has served as Maryland's Special Secretary of Opioid Response since February of this year. In this role, she oversees the Opioid Operational Command Center, which works to promote coordination between state and local partners responding to the overdose crisis. She previously served as mayor of Hagerstown since being elected in 2020, the first woman to hold the position. Before her term as mayor, Emily served as a councilwoman on the Hagerstown City Council since 2016. She was a member of the Opioid Senior Policy Group in Washington County and has served on various boards in the area of substance use disorders. Please help me welcome Special Secretary Keller.
Thank you very much, and thank you, County Executive Hornberger. Thank you for your passion and how dedicated you have been to this issue. It is truly from the bottom of my heart. I can't tell you how much I appreciate you and what you've done and what Cecil County's done. So thank you. It's wonderful to be here with you guys this evening. My name is Emily Keller. I'm Maryland's Special Secretary of Opioid Response. In this role, I oversee the Opioid Operational Command Center, which is Maryland's primary interagency coordinating office for the state's response to the overdose crisis. As the county executive mentioned, I previously served as the mayor of Hagerstown until earlier this year when Governor Moore asked me to join his administration. We talked about the special focus that he would be putting on substance use and what we could do to get more help to those who need it. It was an offer I couldn't turn down. This work is something that I am deeply passionate about. Like so many of us, or really all of us at this point, the opioid crisis has affected us, and it's affected me personally. I began my life in public service after watching my best friend Ashley struggle with a substance use disorder. I felt like I watched our system fail her over and over and over again. And instead of sitting on the sidelines and complaining, I decided I was going to run for office and try to do something about it. Unfortunately, substance use disorder cost Ashley her life. But while she was here, I promised her that I would be loud and I would be bold and I would give a voice to the voiceless. And that's exactly what I intend on doing. It's my honor to be here with you tonight to learn about the great work that's being done here in Cecil County to help people with substance use disorders. And I'm greatly looking forward to hearing from all of you and your ideas of how we can do more to prevent overdoses and save lives. For those of you who might not be familiar with our office, the OOCC, or the Opioid Operational Command Center, works with all state agencies to promote collaboration and coordination to address the opioid and overdose crisis. We continue with our partners at the local level through each county's opioid intervention team, and we direct grant funding to help support a wide variety of initiatives by public and private partners organizations. Here in Cecil County, for example, we are supporting youth prevention programming through a competitive grant to the Drug-Free Cecil Youth Coalition. And through our block grant program, Cecil County is supporting peer recovery services in hospitals and post-overdose survivor outreach. The Moore-Miller administration is wholeheartedly committed to expanding access to care for individuals with substance use disorder. This includes record investments in behavioral health services and increasing funding for substance use services by 40%. We are approaching the overdose crisis first and foremost as a public health issue centered on promoting access to quality, compassionate, and person-centered care across the state. At the OOCC, this means looking at overdose crisis holistically and supporting initiatives across 5 pillars that address the overdose morbidity and mortality from all angles. First, starting at square one, we are focused on prevention, which includes strategies that seek to prevent current and future substance use. Some of our key priorities under prevention are addressing trauma and adverse childhood experiences and promoting school-based and after-school youth programs. Our next priority pillar is harm reduction, which is a recent addition to the strategic focus of our office. Harm reduction efforts improve our chances of making connections to care by fostering and maintaining relationships with people who use drugs and meeting them where they're at. Our current harm reduction focus includes working towards universal access to naloxone and expanding access to wound care, syringe services, and drug checking initiatives. Next up, we have increasing access to treatment. Our focuses under treatment include promoting equitable access to care through transportation services and telemedicine, increasing access to medications for opioid use disorder, and promoting care coordination. Our next pillar is recovery and doing more to support the long-term success of individuals leaving treatment. Examples of our priorities under this banner are promoting employment and recovery-ready workplaces, and increasing compensation for peer support services. Lastly, we have public safety. Public safety officials are often the first to come into contact with individuals who use drugs and individuals in crisis. Public safety organizations can also help to create pathways to care that avoid criminal justice involvement, while also providing treatment and recovery services for individuals who are incarcerated. Examples of our public safety priorities include promoting alternatives to arrest and incarceration, promoting treatment and recovery services in detention facilities, and expanding reentry planning services and care coordination upon release. Taken together, we are confident that coordinating action in these areas can help make a difference in the lives of those with substance use disorder. And while Maryland has made significant progress in building a robust overdose crisis response framework, there is much work left to be done. About 7 Marylanders, our loved ones, our friends, our neighbors, lose their lives every day to an overdose. Overdoses that can be prevented with adequate care to access and services. And it's going to take all of us working together to continue making progress, from action at the state and local level to partnership with community organizations and engagement with community members across the state. I'm grateful to everyone here tonight for your shared passion for this issue and for your partnership. And I'm greatly looking forward to hearing your ideas for how we can do more to save lives. And while I have the microphone, before we get to hearing from our community folks, I just want to recognize my team members that are here today. We have Michael, and we have Cleo, and we have Cassie. And I really have a great team. I just want to acknowledge them, thank them for being here. I know most of you in this room have worked with them, so thank you guys for helping organize this. Thank you.
Thank you. Thank you, Special Secretary, and thank you for the comments, and thank you, County Executive Hornberger. At this point, I'd like to turn it over to our Health Officer, Lauren Levy, who's going to present the strategic plan for our overdose response.
Thank you. Can you all hear me? Sorry, just pulling the slides up. Give me 1 second. So thank you, County Executive Hornberger. Thank you, Special Secretary Keller. I really appreciate the opportunity to be here with all of you this evening to talk about our strategic plan for overdose response. Oh, there we go. So I'd like to begin by thanking the members of our, having a hard time. The members of our OIT Senior Policy Group who represent the organizations that are displayed here, maybe? Oh, goodness. I think it might be out of batteries. So next slide, please. Yeah. So thank you to the members of the OIT Senior Policy Group. I really appreciate the ongoing commitment to these efforts and all of this work. Next slide, please. First, I'd like to share our vision: a healthy Cecil County where people with substance use disorder and mental illness have access to services along the full continuum of care, from prevention to treatment to recovery support, and the community actively fosters a culture of health and wellness. Next slide, please. So County Executive Hornberger already provided a timeline of how we got here, but I did want to talk a little bit more about the strategic planning process. After the OIT was reinvigorated after a hiatus due to the pandemic, we began a strategic planning process in October 2021, and a diverse group of stakeholders came together under the umbrella of 4 different subcommittees: treatment and recovery, prevention and support, community engagement, and communication and data, to develop work plans. And those work plans were developed into a comprehensive strategic plan for overdose response that I'm going to talk a little bit about this evening. The plan has been being implemented since November of 2022. I do want to note that several of the programs that I'm going to highlight predate the strategic plan, but are incorporated into the plan as part of the county's overall response efforts. Next slide, please. So these are the 7 goals that were developed as a result of the summit. I'm not going to read through all of them, but you will note that the #1 goal is to reduce the number of overdose deaths. And as County Executive reported, we are really pleased to see that we're starting to see the fruits of that labor, of the work of all of the people in this room, with reductions in overdose deaths this year over last year. But my job tonight is to tell you a story about Cecil County. It is a story of collaboration, of partnerships that are vibrant and bring together the public and private sectors. It is a story of innovation, of public agencies like Community Services developing the COMPASS program to remove transportation barriers for people who are early in recovery. It's the story of community-based organizations like Voices of Hope that have been at the forefront of harm reduction and a compassion-first approach to addressing substance use disorder. It's the story of tireless work being carried out by everyone in this room, by a diverse group of professionals, many of whom I work with at the health department, volunteers, advocates, and community members who are working to continually build up, strengthen, and sustain a robust continuum of care to support people with substance use disorder, their children, and family members. It is a story of our public safety partners going above and beyond their traditional scope of duties to facilitate linkages to care. It's the story of a coalition of people who have experienced tragedy and loss, but it is also a story of triumph. We will hear from my colleague, Aaron Wright, who will share some of his story and how he came to be sitting here with us, helping to lead this conversation and write the next chapters of this story. Next slide, please. I want to highlight the priority areas that are driving our work. Our goals generally fall into one of these three priority areas. They are access to care, prevention and support, and communication and data. And I'm going to share some of the progress that is being made in each of these areas. Next slide, please. Access to care is a critical component of our efforts to address substance use disorder, mental illness, and overdose in Cecil County. People need to know how to enter the system of care, and they need to know how to help their friends and family members access the system. They need to receive the appropriate type of care, and there must be sufficient resources available to ensure that people receive care in a timely fashion. Next slide, please. I talked briefly earlier about the continuum of care and the tremendous work that has gone into building that continuum. Special Secretary Keller also talked about it. We talked about years ago when we started having these conversations about 4 pillars. Now there are 5 pillars. What we continue to build here in Cecil County is a comprehensive system of care. We have primary prevention efforts with agencies like Youth Empowerment Source, Cecil County Public Schools, and the Health Department working to strengthen resilience in youth. I mentioned our public safety partners who've taken on a significant role in this system. Our behavioral health providers are critical to ensuring that county residents have access to treatment. We have recovery services organizations like Voices of Hope and the county's recovery houses providing critical support to people in recovery. Harm reduction ensures that we are meeting people where they are and holding that door open to them when they are ready for treatment. So what does this look like on the ground? Next slide, please. I noted that our number one goal is to reduce the number of overdose deaths, and Narcan has been instrumental in that effort. In just the past couple of years, we have had several key partners like the Department of Emergency Services, the Cecil County Detention Center, as well as Christiana Care Union Hospital taking an active role in Narcan distribution. Next slide, please. We often talk about a no wrong door approach. And then on January 1 of this year, the Cecil County Detention Center, in collaboration with Prime Care Medical and the Cecil County Health Department, launched its medication-supported recovery program that provides access to care for incarcerated individuals, a population we know is at heightened risk of overdose upon reentry. I'd like to thank Special Secretary Keller and the Opioid Operational Command Center for their generous financial support that has resulted in Cecil County being a leader in the state for HB 116 implementation, with 189 individuals served in the first 6 months. Next slide, please. Many of us have been in rebuilding mode over the past year or more, and no organization more so than Christiana Care Union Hospital, which weathered the storm of the pandemic and has emerged with an even stronger commitment to community outreach. I have to give a shout out to Lisa Fields from Union, who has been a true champion of our efforts to expand access to peer recovery specialists in the hospital, building on a highly successful program that was in place pre-pandemic with the health department. Over the next few months, thanks to our partnership with Union and Voices of Hope, we're going to be able to expand on-site peer access from 8 a.m. to 5 p.m. 5 days a week to 8 a.m. to 1 a.m. 7 days a week. Next slide, please. Cecil County has been at the forefront of public-private partnerships in this space, and this is exemplified by the Cecil Addiction Treatment and Coordination Hotline, or CATCH, where Voices of Hope and the Health Department partner to ensure hotline and walk-in access to a peer recovery specialist and linkages to care 24 hours a day, 7 days a week. The CATCH hotline connects more than 60 people to treatment each month and shows how beneficial these partnerships can be. Next slide, please. I said that this story was a story about innovation, and Voices of Hope established the county's first harm reduction program in 2018. And their tireless efforts to address the healthcare needs of people with substance use disorder through services like wound care have received national recognition with features in the Wall Street Journal and the Washington Post. Today, Cecil County is home to 2 state-approved harm reduction programs at Voices and the Health Department, with both programs offering access to a wound care nurse. Our dedicated harm reduction teams meet people where they are, but they don't leave them there. I'd like to pause for a moment to allow Aaron Wright some time to talk about his experience and impressions of the work happening here in Cecil County.
Thank you, Health Officer Levy. And thank you, Special Secretary Keller, and of course, our County Executive, Daniel Hornberger. So if I may qualify myself to speak on this behalf, so I was a heroin addict for 23 years. And if I can take you back to about 9 years ago, what it might look like of these individuals that we speak of accessing services. The man sitting in this chair was about 115 pounds. I was walking down the streets of Girard Avenue in Kensington, Philadelphia. Shell of a man, not wanting to die, but waiting to die. And as I was picking up cigarette butts, because that's what I did on a daily basis because I was homeless, I came across an ice cream truck. But it wasn't a normal ice cream truck. This ice cream truck had people out front of it who were leaving with brown bags. So I kind of knew what it was. I kind of knew that there were syringes there, right? And even though I was on a methadone clinic, which was also saving my life, I was also getting high. So I approached this ice cream truck with caution. When I got up to the first window, there was a gentleman who said, "Hey, listen, do you have a card?" And I said, "No, I don't. Please don't ask me for my ID because I don't have it." He said, "I don't want your ID, but you need this special number that I have to give you so I know that you're on the program." So he asked me a bunch of questions and then handed me this card. He said, "Step to your right." So when I stepped to my right, there was an individual that had a bunch of syringes and tourniquets and a bunch of Band-Aids and alcohol wipes and stuff behind him. This gentleman said, "Well, what do you want?" And I said, "I don't know, just give me some syringes." Because at this point I was still cautious because I thought I was going to be locked up. So after I told him what I wanted, he put it in a bag and he handed it to this woman. And the woman said, "Hey, listen, have you been tested for hepatitis C or HIV, or would you like any other shots or vaccines?" And I said, "No." Because at this point I'm getting very edgy, right? And I just want that bag. I just want that brown bag. So then the person handed the bag outside to a person who was standing behind this table, this young woman. And I knew I was that close to getting high. And when I went to grab that bag, time seemed to freeze. Because in this girl's eyes, she saw the deadbeat father that I had been for 9 years. The little girl who I watched celebrate 9 years' birthday in federal prison. The shame and guilt of being molested at the age of 7 to 9. The hurt that I never met my father. And she wiped that away like it was chocolate on a 3-year-old's face. And she saw me. She saw a part of me that I wasn't able to see in 23 years. And in that moment, she reached down and planted some type of seed that was a little piece of hope. And the only words that that woman said was, "Anytime you want to talk, I'm here," because I was standing where you are 6 months ago. That was it. So if I can fast forward to about 3 years when I came to this wonderful county in recovery, and I heard and I saw places like the Manor and Lakeside and Winey Brook, and I saw a little piece of me and all those people. They said, "Well, let's build a harm reduction program." And thanks to the partnership with the Cecil County Health Department, we have 2 syringe service programs. And when I say syringe, I don't want you to think of needles. I don't want you to think of that. I want you to think of that connection, that seed that we get to plant on a daily basis to those individuals that are walking around in a shell of a human being, just like I was. And we see them the next day and the next day. And what we've done here in Cecil County is we've attached that to 24/7 treatment navigators. Excuse my French, but we are one badass peers that are trained with the skills to not only motivate, but we have over 300 master resources on our master resource list to coordinate treatment, because we know when that individual is ready, we have 5 minutes to get them to their next destination, because if we don't, we might not see them again. And we are 97% effective to have them on their way to their next treatment destination within 2 hours, if not 15 minutes.
Thank you, Aaron. Next slide, please. So moving on to our next priority area, prevention and support. Preventing the onset of substance use disorder and mental illness are some of our most effective tools for reducing the number of overdoses in Cecil County in the long term. To be successful, we must foster a culture of health and wellness that recognizes the importance of prevention efforts and early intervention to prevent SUD and mental illness. Strong support systems at the individual, family, community, and professional level are also essential. Next slide, please. That work is being led in Cecil County by Youth Empowerment Source, Cecil County Public Schools, and the Health Department, among many others. And I'd like to highlight some of the great progress that has been made over the last couple of years in particular. Last year, for the first time, middle school students were able to spend a full day participating in the Youth Leadership Summit, learning about principles of prevention, thanks in part to OOCC funding. Last year, an astounding 3,111 students in Cecil County participated in prevention activities. Strengthening youth resilience is critical to reducing the risk of SUD and mental illness. Last year, Youth Empowerment Source piloted the Prepare You curriculum for the first time at the Youth Leadership Summit, and it was a tremendous success. It's an evidence-based mental health skills training curriculum, and more than 80% of youth reported that they were better able to manage their own mental health after participating in the training. We're also working to build capacity among educational professionals to meet the mental health needs of students. Thanks to grant funding, we'll be able to send several CCPS staff to this year's annual conference on advancing school mental health. I cannot understate the importance of these activities in breaking the cycles of generational trauma and building a stronger future for the children in Cecil County. Next slide, please. I spoke about our public safety partners being at the forefront of strengthening the no wrong door approach to the system of care. The Prevention and Overdose Response Team is a perfect example of these efforts. PORT is a multi-sector partnership led by the Department of Emergency Services, but as important is the fact that it is led by people with lived experience. Next slide, please. I mentioned the COMPASS program, or Cecil On-Demand Mobility Platform and Service Solution, in my introduction as an innovative model for addressing transportation barriers, especially in rural communities. COMPASS is providing critical support to people in early recovery, with about 15,000 rides provided to date. Next slide, please. Addressing adverse childhood experiences is essential to achieving our vision of a healthy Cecil County. The Trauma Initiative, made possible through funding secured by community services, has ensured that many children and family members of people with substance use disorder have access to therapy, access to school-based grief support groups, and parenting classes through My Family Matters. Next slide, please. Next slide, please. Our third priority area is communication and data. Communication and collaboration are key drivers of our work. We need to ensure that critical messages reach individuals and communities in need. We're committed to approaches that are data-driven. Data sharing will allow us to better use our limited resources and avoid duplication of effort. It will also allow us to continually evaluate our efforts and track outcomes. Next slide, please. RewriteYourScript.org is continuously updated to serve as a comprehensive and up-to-date online resource for people seeking information regarding treatment, prevention, recovery support, overdose prevention, and harm reduction. Next slide, please. We often talk about the overdose epidemic in terms of numbers, but we can never forget the real people behind those numbers. The people in Cecil County with lived experience are leading the charge to find solutions and meet community needs. And this is on full display in this video that I hope to be able to play for you now, that shares real stories and centers the voices of people with lived experience and tackles stigma head on.
I'm originally from Upper Darby, right outside of West Philadelphia, and found myself using drugs every day since the age of 19.
My late husband passed away from brain cancer, and that is kind of what made my spiral into addiction. Started with alcohol, marijuana. By the time I was 16, I was a full-blown IV heroin user.
My mother was addicted to crack. My father wasn't in my life. I grew up in rough projects of Boston, Massachusetts. So I grew up in poverty. I grew up bitter. I grew up hurt.
I found recovery here in Cecil County, and I've been clean now for over 7 years.
Being in that spot where you don't know where to turn to, you don't know where to start, and the fear of the unknown, The Rewrite Your Script helps you with that. You're holding the pen, your book's not done, your pages are still unwritten, and it doesn't have to end with just the 3 jails, institutions, of death. You can rewrite your script and continue your story in a life of recovery, and it's possible.
So where my recovery journey has brought me through medication, through methadone, through Suboxone, I now have a life beyond my wildest dreams. It has taken a homeless person and given him a home here in Cecil County. And most of all, it's taken a person who was very hopeless, now filled with hope and willing to help others.
If you are struggling, I'm talking to you, and there are multiple resources available. We have a cash line, we have a website, we have the building itself, and the people who work in this building have compassion. We understand you. We are you.
If you feel like there is no hope and everybody's given up on you, call Catch. We know how you feel. We know where you are. We know in that very, very dark place you can seem alone, but you are not alone. Just call, please.
Thank you. So that is a bit about, So that is a bit about where we have been, and I'd like to talk briefly about where we're headed. Next slide, please. First, we are hoping to dedicate some of the opioid settlement funds to conducting a behavioral health landscape assessment. The last assessment was conducted in 2013, and a lot has changed since then. Our goal will be to assess the gaps in our current continuum of care and identify strategies to address unmet needs. Next slide, please. We've been talking for many years about a comprehensive data platform, and I'm pleased to report that we have contracted a vendor to develop a data warehouse for us using the PORT program as a pilot in what we hope will become a model for the state. Future plans include the development of a public-facing data dashboard to ensure the transparency and accountability of our efforts. Next slide, please. Prevention is always a priority, and mental health has been identified as the top priority in the most recent iteration of our community health needs assessment. We'll be working to address mental health countywide through programming that fosters social connection, dissemination of evidence-based training to strengthen understanding of mental health, and strengthening our informal system of care so that members of the community are equipped to recognize the early signs and symptoms of mental distress and provide support and connections to care for their family, friends, and the broader community. Next slide, please. We know that it will be critically important to expand the behavioral health workforce, and we will be adopting a multi-pronged approach to doing that, including strengthening the professional pipeline through scholarships and internship opportunities, the exploration of incentives to encourage providers to offer their services in Cecil County, as well as policy advocacy regarding common sense changes to reciprocity rules that will allow more professionals licensed out of state to gain licensure in Maryland. Next slide, please. Strengthening our partnerships will be key to all of this work. We want to build a response that is truly all of county. We want everyone engaged in this effort on some level. We want a big tent approach filled with many different kinds of people from many different walks of life. Next slide, please. I've talked about the various agencies and organizations this evening, but people are the driving force. Next slide, please. These are the individuals who are behind those agency logos, the people doing the important work here in Cecil County. I want to thank everyone who was engaged in this work. I also want to acknowledge the OIT members who helped to develop our strategic plan. Thank you for your commitment to a stronger, healthier Cecil County. Next slide, please. Next slide, please. If you are not already engaged in one of the many collaborative efforts highlighted this evening, please join us. I've included here a few ideas for ways to get involved, but please also consider volunteering with our community-based partners. Please reach out to anyone sitting up here or any of the organizations mentioned tonight, and we will make sure to get you connected to the opportunities and to participate in these efforts in meaningful ways. Aaron, I know you spoke. Is there anything else you'd like to add about our efforts here in Cecil County?
Sure. Thank you, Lauren. Every time they show that video, it makes me cry, so I'm sorry. But I just want to say, I just want to say, coming from, I was given a 13% chance to see the age of 30, according to my ACEs score. Miracle in itself. I met a woman who is now my wife, But about 8.5 years ago, she had overdosed in Meadow Park with her 1-year-old daughter in the back, but thanks to the Elkton Police Department, who actually had Narcan, was able to reverse that overdose. I have a son who was born dependent to heroin and cocaine, failure to thrive, had a feeding tube, wasn't sure he was gonna make it. And he's thriving 6-year-old today. Unfortunately, his mom, his biological mother, died of an opioid overdose. I want to say, from a person in recovery, right? We are very judgmental and crucial when it comes to services, because we will call you out on your BS. Excuse me if I'm mistaken, but how much it is of an honor for someone in this county to be in situations that I was in, to ask for help, to even have a blip on an overdose, whether through law enforcement, EMS, the hospital. From that point in time, from that man over there, Bob Cameron, for it to go to the Cecil County Health Department, and that man over there, Bill, for it to come to Voices of Hope, for it to be blasted, you might as well put a sign in the sky that says, hey, this person needs help. And to watch all of this happen, and all these numbers really don't do it justice. They don't, because I've seen it. This stuff happens, I wanted to say another curse word, but this stuff happens real quick, really quick. But to see how long it has taken us to get there, for that person to get there, get the help, get the services, even if it's through harm reduction, because we don't judge, because we know when you're ready, you're going to be ready. But to have them walked over to the CATCH program and have treatment navigation, have them go into treatment in 20 days, catch them on the back end, set them up with recovery house, call Dottie for funding so we can fund them in that recovery house for 60 days because they can learn to live like a human being again without the use of drugs, is priceless. And that all happens. And when I say it happens within 5 minutes, it happens within 5 minutes. So I think I can speak on the behalf of the recovery community that I am proud of what this county has done and the partnerships that we have and everybody in this room. Thank you.
Thank you so much, Erin, for sharing your story. I so appreciate it. Dave Shirley, we will hand it over to you.
Thank you, Lauren. Thank you, Aaron. I think we're running really well on time. So I have the distinct pleasure of providing a brief overview of the Opioid Restitution Fund as it relates to Cecil County and the opioid litigation settlement and subsequent agreement that was passed. So I'm going to try to provide this overview as briefly as possible. I'm going to try to do it sequentially and as to how it occurred. Please understand this involves a lot of moving parts. A lot of information is still out there. So at the conclusion of this, I will say if there's any questions, I would be more than happy to answer them outside. And I will say on behalf of the county, we will continue to be forthright and transparent with this process as it relates to the Opioid Restitution Fund at the state level. So the county initiated litigation against manufacturers and distributors of opioid prescription products, with the anticipation that a settlement would be reached and subsequently monetary disbursements would be made to the county. On or around October of 2020, legislation was passed by the county council that established an opioid trust fund and a subsequent agreement and the establishment of trustees to manage that. The trustees were tasked with the responsibility of administering the trust fund. They were also given the authorization to invest and manage the account as well. There are 8 trustees. They are not named by names or titles. They're named by positions. They are currently the county executive, his or her designee, the president of the county council, his or her designee serves as ex officio, the director of emergency services for Cecil County, his or her designee, the state attorney for Cecil County, his or her designee, the sheriff for Cecil County, his or her designee, the director of finance for Cecil County, his or her designee, the health officer for Cecil County, his or her designee, and the director of community services for Cecil County, his or her designee. As this was passed, I will tell you that the county believed wholeheartedly that upon settlement, that a windfall of funding would come in one lump sum. As such, this is worded and the agreement reads in a way that almost is the investment or management of what would be considered a brokerage account. Now, what I will do is kind of go over the chronology over the course of the next year or two after this was passed and then lead up to where we're at today. So in July of 21, national agreement was released to the states related to the settlement of select manufacturers and distributors of the opioid products. In August of 21, state of Maryland signed on to that. Shortly thereafter, the manufacturers and distributors signed on to that same agreement. And in September of 21, notice was sent to subdivisions within the state of Maryland. Now, understand the term subdivisions refers to those participating counties and those towns and cities within the state of Maryland. In total, there are 58 of those, 23 counties, and 35 towns and cities included in that. On or around January of 22, Maryland subdivision signed on to the agreement. And that involved the signing of an MOU as to how the settlement funds would be distributed, and of course, agreeing to conditions of how those funds would in fact be expended. During the legislative session of 2022, House Bill 1086 and Senate Bill 419 were passed, and this established the opioid restitution fund at the state level and appropriation of the settlement funds and grant programs. It essentially codified a division of the funds, and an agreement was created between the states and the local subdivisions related to the settlements. The spending allocation was determined by permitted use from the national settlement agreement and also by what is called Section 7-331 of the Maryland Finance and Procurement Article. That specifically tells what the uses of these funds are. One thing I would like to emphasize with that is that generally the permitted uses are limited to future opioid remediation. Now, the state subdivisions are as follows. There's a state allocation of 15%. That is permitted use as determined by the state. There's targeted abatement subfund, which is divided into a 60%, so targeted abatement grants, and then some state discretionary money. And then there's 25 contributed for the local allocation. In November of 2022, the first installments were then sent to the counties. And over the course of the next 4 to 5 months, 4 installments were included, both the targeted abatement funds as well as the local distribution. In total, approximately statewide, about $60 million. Of that $60 million, there is still another, that is 60 of about $395 million to be dispersed over the course of the next 18 years. And that does not necessarily include additional settlements that are being worked on at this present time. Cecil is eligible for local payments as well as being a qualifying county for the targeted abatement funds through the grant program. Now, I want to be able to say that several things are occurring that we should be aware of. There's different accounts, different sources of funding, different requirements that have to be conformed to at the same time. And there's regulations associated with all these. Secondly, as I stated, this legislation passed during the 2022 session. There was an administration change at the end of it. The administration, similar to the previous administration's goal, is to make sure that this funding is distributed in a targeted and efficient and organized manner, which requires making certain that all the regulations associated with the national agreement, as well as those associated with the state article, are conformed to, which is a lot of work at this point. Now, with that, I'll share where are we at today. So I'll start out with saying the local allocation, where we're at. At the county executive's urging earlier in the year, we convened the trust group and the trustees to talk about this. As I previously stated, the initial agreement was passed with the understanding that this would be a lump sum of funding at one particular time. What we've come to find out that these are much smaller installments that are going to be distributed to the county over the course of the next 18 years. The current agreement has the ability to be amended by a proposal of the county exec, approved by 2/3 of the trustees, and then lastly approved by the council. So the goal there would be to rather make this agreement depict more accurately the funding coming out, and to use this group with the set goal of either dispersing to programs and or services to address the opioid epidemic, or consulting or collaboratively working with another entity such as the opioid intervention team to serve as the conduit to disseminate this funding to services and programs to address that. However, we are still waiting because this funding, along with the abatement funding, is still considered opioid restitution funding. So it is subject to rules and regulations that we still have to make certain of for auditing purposes and how we report said funding. Now, the targeted abatement funds. There are a couple things that we know about this. We know that it's going to be in the form of a grant. We know that as a county, we have to create what's called an abatement plan. The abatement plan is essentially will include part of or could replicate the plan that Lauren just presented to us, which is a strategic plan of how Cecil County will address the opioid epidemic. Like a grant, it requires a problem statement. It requires the impact of the opioid crisis on the counties. It requires goals, objectives, methodology of how you will address those, outcome measures, collaborations, consultations, and who are our partners. So it requires a community-wide effort to submit this. And again, still waiting for feedback as to exactly how the money has to be used, what our reporting requirements are. So as we move forward with this, our goals are going to be as transparent and forthright with the public on how this funding will be spent. We are going to continue to work with the trust group and the trust agreement to make sure that the dissemination of the local dollars are done in a transparent fashion. And then we will work with the community on how we ascertain the targeted abatement grants at this point. So as I said before, I will be available for any questions or answers after this event tonight. And I thank you for the opportunity to present. At this point, we're going to segue right into our public comment section. So if you would, I'm going to call individual's name and ask that they come up to the podium. You have 2 minutes to speak. We will start out with Jen Turk. Yeah. I'm sorry, Jen, go ahead, use the podium.
Okay, I got a 2-minute countdown, hold on. Good evening, everyone. My name is Jennifer Turk, and I'm a person in long-term recovery and the executive director of Voices of Hope, a nonprofit recovery organization that serves Cecil County. Voices of Hope are people in long-term recovery, family members, and allies who have come together to help fill gaps in the continuum of care. Our programs and services are designed to help individuals who use drugs to stay alive and overcome barriers to long-term recovery. Thank you, Emily Keller, for making Cecil the first stop on the OOCC town halls and visiting us in person. We appreciate all of your interest in how we are fighting for lives and access to treatment and recovery. Voices of Hope owes its success to state partners, including the Maryland Department of Health, as well as local partners, such as the Cecil County Health Department, the Cecil County Government, Christiana Care Union Hospital, Susquehanna Workforce Network, and the Sheriff's Office, as well as local funders such as churches and the United Way of Cecil County. We work together to form a safety net of services for individuals with opiate use disorder so they can access harm reduction services, treatment, and recovery supports anytime, including nights, weekends, and holidays. Recovery takes place over a lifetime after treatment with our families, working jobs, and in our community. In order to build programs with impact, financial sustainability of our organization is a must. We are asking that 10% of future state block grants are set aside for nonprofit recovery community organizations. We ask that 10% of all opioid restitution dollars be set aside for capacity building and sustainability of community-based organizations. What Voices of Hope does for Cecil County can be duplicated in all counties, providing restitution or making things right to those affected by opioid use disorder in Maryland. Thank you.
Thank you.
Thank you, Jen. Forgive me if I'm mispronouncing this. Lisa Nurnberger? Okay, moving on. Lisa Fields.
2 minutes. Sorry. See if I can do that. So I have a written speech tonight, but thank you for letting me come up. So my name is Lisa Fields. I am the Community Engagement Manager for Christiana Care. Most of us know Union Hospital. Many of you guys know that a couple of years ago, we started the integration with Christiana Care, and then the pandemic hit. And we all turned to COVID and how we were treating our patients. So fast forward that, I have also been at Christiana for 21 years. And in January, I started a new role as a community engagement manager, which I truly love. And I get to work with wonderful people like Lauren and Aaron and Ken and Dave and April and so many of you in this room. It is a true passion of mine. I want to stand here tonight to tell you that Christiana Care Union Hospital is still Union Hospital. It is our community hospital. We are committed. And like most of us, we lost our way a little bit during the pandemic, but we are truly committed to serving this village is what it takes in our community. I'm excited about this peer project that we are working on. I personally want to tell you just a second that I'm standing here too as a mom. and I'm a mom of 4 boys and 1 girl. And I am a mom of a son who has suffered addiction most of his life, and he will be turning 40 years old in March. I laid awake many nights as a mom wondering where he was. And I, in my mind, many times I buried my son and thought about his funeral. And that's a horrible thing that no parent should ever have to think of. My son got lost in the streets of Baltimore, and we really did not think that he was going to come out. And it was a peer, much like you, who came to his bedside inside of the walls of a hospital that made the difference in my son's life. And today he still depends on those peers. So I'm here to tell you how important peer recovery is and that we are truly committed. Thank you for letting me speak.
Don Mathis.
My name is Don Mathis. I live in Havre de Grace, but I do a lot of work in Cecil County. I first want to thank the county executive and the special secretary for this session, Health Officer Levy, and Dave and I go back a little bit, so it's good to see him. And Aaron, I'll catch up with you later. I'm wearing 3 hats tonight. The first hat is I'm on the board of the Susquehanna Workforce Network. Have been for about 25 years. That's where David and I first took up. We are going to get one of the recovery-friendly workplace grants from the state. And what that does is and I've been on the workforce for about 25 years, and I've heard we can't find workers, we can't find qualified workers, we can't find people that can hold these jobs. Recovery Friendly Workforce Grant under Susquehanna Workforce, we will help people in recovery find workforce opportunities, jobs, credentials, and what have you. We will help employers that have people with substance use disorder help look their current employees into treatment and what have you. And we also have access to model human resource plans that companies can use to update to allow this to happen. That grant will kick off quickly. That was my Susquehanna hat. My Voices of Hope hat. On the opioid recovery funds, 6 days of detox is wonderful, often necessary. 30 days of treatment is wonderful, often necessary. But after that, there's a lifetime of recovery that people need. And I think recovery services are just starting to get funded and awareness and what have you. That takes money, it takes peer support. It's not as expensive as inpatient treatment, but that's something that certainly the opioid restitution funds should look at. And my third hat is one is a person in long-term recovery. And I need to give props to Barb Smith for all the trauma work she's doing here in Cecil County. You guys are on top of it, but I know, Special Secretary, that there was a governor's commission on trauma that had been established. I don't think it's met since January of this year. I used to teach at Del Tech. I taught healthcare resources and what have you, and I've seen what a state commitment to trauma-informed care could do. I ask you to consider rejuvenating that. Thank you.
Chanel Pounds. All right, moving on. Sam Dickerson.
Hey, what's up, y'all? Thanks for letting me talk tonight. Thanks for being here late on a Tuesday night. I'll sign off on your comp time and leave and all that. I'm a person in long-term recovery. I've been clean a little over 10 years. I got clean through Cecil County Health Department in Cecil County. My pathway was inpatient treatment and stepped down through the levels of care to IOP, to OP, to 12-step fellowships. That's what worked for me. It was an abstinence-based pathway, and I found it to be a long-term solution. I worked as an addiction counselor. I started as a peer recovery specialist in the field in 2014. I've worked as an addiction counselor since 2017. Recently became licensed as a social worker, and I've been able to put myself through school as a single parent, as someone who's also lost the biological mother to their child from addiction. And I've seen a lot of people pass away in the last 10 years and a lot of loss and a lot of gaps in the system. So I just wanted to touch on a few of those. In the interest of time, I just want to say thank you for, I didn't even know all the stuff that we're doing in this county. I mean, it's grown so much since I started working in the field. It's just amazing to me to see how much that we're doing, how much the health department's doing. Voices of Hope wasn't even a thing when I got clean. We used to meet in a room in the health department and try to ask what our name was going to be, right? I remember these days, and a few things that I see from working in the field is that treatment centers now are not accepting people with wounds, and this is a huge barrier to care. We need to find a way to get treatment centers accountable and to get the right medical staff on board to accept people with xylazine wounds. It's keeping people from getting well. Treatment centers need to provide a higher quality of care, especially on an outpatient level. Telehealth was great, but it's hurting a lot of people, and it's easier for the treatment centers to make money that way. Safe and sober housing after inpatient treatment, we need investment there. And after jail, they need a place to go. They can't go back to the hood. So if we can find ways to invest county money in those places, I think it'll go a long way. Thanks for letting me share.
Thank you.
Chris Jones.
Let me keep it short and sweet. Good evening, everyone. Thanks for having us here. I am Tricia Jones. I'm the director of the Dexter House, and we also have the Charlotte House for Women. In 11 days, we will be 10 years old. In that time, we have housed over 305 individuals and helped countless others find their way into treatment and recovery. In the last 10 years, what we've seen has been more than eye-opening. What we've learned is that the disease of addiction is more powerful than ever and not something to be managed. It needs to be treated. And individuals entering into recovery need to be supported. Amen. I would like to point out that in the last 2 years, our residents have received 0 state dollars. They haven't received any housing assistance or care coordination money. That was after, I guess, a casualty of COVID. We need housing dollars for Cecil County that does not have hoops to jump through or strings attached. We need mental health providers here. We need an incentive program to bring them here. We've lost a lot to Delaware and Pennsylvania. The billing's easier, the workload isn't as much, and the pay is better. I can tell you that that is probably our biggest problem, is finding a provider. And we require it. So we're setting them up for failure right off the bat. We appreciate our local government, our county executive, and the efforts to address this epidemic here. Recently, we were given some hope when we received local dollars that will help men and women coming out of treatment in the way of housing scholarships. And I can tell you that the only reason that we do what we do is to see the miracle of recovery. Thank you very much.
Aaron.
Thank you. So I also want us at a level of the services that we're doing, you know what I mean, upstream and midstream for individuals with substance use disorder and mental health for that matter. But I want everybody to take notice of that. Since COVID, we have lost 27 meetings. And when I talk about meetings, I talk about 12-step meetings. They have lost their place here in Cecil County because churches have shut their doors and there was no place to meet. You're looking at someone that must maintain 3 meetings. For me to dress like this, shower every day, and be a productive member of society, I have to hit 3 meetings a week. And I have to find myself that I have to now go further for those meetings because a lot of meetings have closed down. So I know, Special Secretary Keller, that one of those pillars is recovery, not treatment, recovery. And if we can have and sustain a place where it's open to all pathways of recovery, any meeting 24/7, with that grant, because it's hard to get data when people remain anonymous, but I can give you attendance. So if we can allocate some of those funds to maintain supportive environment that recovery meetings can be held and not worry about if they're going to have a place to meet the next week, that would be great. Thank you.
Thank you, Aaron. That includes our public comment. Yes, George?
Make one comment because it's the elephant in the room. Assistant Secretary, we need a facility in this county. We need it here. We have the collaboration of everybody in this room. We don't have a place to do it. We need a facility. Any way you can get a facility here, they'll all tell you, we do a great job working with people here, but we lose them. We got to send them somewhere else. They need to be treated here. They need to meet here. They need to recover here because this is their home.
Thank you.
Thank you, Major.
With that, I'll turn it over to our county executive for closing remarks.
Well, I don't have any official closing remarks, but before I do kind of tie this all up in a nice little tidy bow, I would like to mention that we do have a new facility in Cecil County Concerted Care Group. We're pretty excited that they do provide mental health treatment, wraparound services, and this is absolutely something, as we can all note, very needed in this community. So, we've seen a lot of progress in the last, it's not in the last couple years. This has been ongoing progress over the last decade plus from a lot of people in this room. And we appreciate you all. Everyone here cares, and that's huge. And we'll continue working together for the betterment of this community. Thank you.